Hi, I'm Dr. Robert LaBelle. Today we're going to be discussing plantar fasciitis and other foot-related issues. Plantar fasciitis is a common condition we see at CCSR. It's very often related to some Achilles issues and as well some calf issues. Plantar fasciitis can affect us all at some point. Basically, all of us stand and thus we load the heel quite a bit and we load the arch muscles. And as time goes on, if we have potentially poor foot biomechanics or we overload the foot a lot, the heel could end up developing scar tissue, as well as the muscles in the arch can develop contracture and some stiffness. Plantar fasciitis is felt very often as a burning sensation in the heel. That burning sensation in the heel is usually worse in the morning when one first gets out of bed. When we first get out of bed, our foot has had the opportunity to contract all night long because we're not on it. And as we first get out of bed, we end up stretching out the plantar fascia due to the load of weight bearing. As we do this, we will end up irritating the attachment of the muscles and the plantar fascia to the heel, and some intense heel pain can be felt as a primary symptom in plantar fasciitis in the morning. Likewise, if we use our foot a lot during the day, i.e. if we had plantar fasciitis and we went to the zoo and walked around all day long, just the constant overload of working the foot muscles and the heel can cause an aggravation, and that intense heel pain can be felt again. In the treatment of plantar fasciitis and other arch-related stiffnesses and discomfort at CCSR, we typically will look at the plantar fascia locally and then relate the plantar fascia into the entire biomechanics of that same leg, as well as the entire body. Invariably, plantar fasciitis, we see patients who have plantar fasciitis have tightness to the calf, hamstrings, as well as the glute and low back musculature. So treatment would be aimed initially at releasing tissues here through active release-like methods, as well as showing the patient home therapy exercises with a ball, and as well teaching them to stretch the calf specifically and deal with the posterior kinetic chain issues throughout the leg. As we look at the foot, we very often have a number of associated disorders. Plantar fasciitis is typically heel pain. However, we can get some deep arch muscle pain that goes along with that. And very often patients can get what we call metatarsalgia, which is pain across the forefoot here. Ariana's foot represents that very well. She has a callus over her second toe or second metatarsal. And calluses very often represent pressure, excessive pressure, which over time causes the skin to develop some hypertrophic scarring. And if the skin has developed a callus, then we know that the soft tissues underneath have developed tension as well. A release of certain tissues through there and the arch muscles is very often curative for plantar fasciitis. One thing that is important to understand with plantar fasciitis is it's a reluctant condition to get better. And the reason is that we spend a lot of time on our feet as humans. We very often just don't lay around all day long. And so a good rest or good supportive shoes at home is critical to the treatment of plantar fasciitis, along with the therapy in office. If the condition is still reluctant to healing, what we very often will do is start to assess the foot for its foot biomechanics. Very often we have pronation, which is a dropped arch, or supination, which is a raised arch, and we very often would prescribe an orthotic to help manage those poor foot biomechanics that lead to the plantar fasciitis.